Hello. Welcome, everyone. Thank you for joining today's session. Folks are trickling in, so I'll hold off for 10 seconds. But welcome. Thank you all for being here. Appreciate the attendance. Always excited to see folks here to join these wonderful sessions, especially this year. It's been a great conference so far. So thank you for being here. My name is Swaveen Gongo. I use she, her pronouns, and I am the president of the Colorado Public Health Association. On behalf of CPHA, I'm honored to wish you all a happy last day of National Public Health Week. And so thank you for being here on a Friday and for Culture of Data 2023. We really appreciate your presence and your engagement. I'd like to kick off this session by thanking our sponsors for the session in Trailhead Institute. And so Sarah, please do take it away.
Yes, I have to unmute. Man, you'd think after so many years. Thank you, Aveen. Hello, my name is Sarah Lampy. I use she, her pronouns. I'm the President and Executive Director of Trailhead Institute. We're so honored to sponsor today's skill building session with Jeff, Rachele, and Alina on centering the power of community voice to transform existing data collection and implementation practices to advance health equity. At the heart of Trailhead's work as a nonprofit public health institute is the belief that communities are best suited to identify and address the issues they face. And Trailhead's work centers on building and growing the resources that communities need to implement solutions. This driver around building community capacity makes us particularly excited for the skill building session, discussing how data can center the voices of those with life experience, drive impactful community change through solutions that honor and reflect community input, expertise, and self-determination. Thank you to Jeff, Rachele, and Alina for sharing your important work with us in this action-focused skill-building session. Thank you, Livy.
Thank you so much for that, Sarah, and we appreciate your sponsorship and your participation. Thank you. So great, we will kick it off. This skill building session titled Transforming Data into Action for Equity will give participants the skills to transform existing data collection and implementation practices into a toolkit for advocating health equity by centering the voices of those with lived experiences. This session will continue until 11:30 this morning. And so for any tech issues along the way, please feel free to message our tech host, Julia. And with that, it is my pleasure to introduce this workshop's speakers and guiders, Jeff, Rachele, and Alina. Take it away. Thank you for being here.
Great. Thank you so much. And thank you so much to our sponsors for this workshop. We're excited to be in this space with you today. My name is Rachele Espiritu, and we'll be talking about how to transform data to ignite action for health equity. So this is our team today. Again, my name is Rachele Espiritu. I use she, her pronouns. I am based in Denver, Colorado, and I am a managing partner for Change Matrix, which is a small woman-owned, minority-owned business that happens to have a team of folks here in the Colorado area. I also serve as the Colorado Equity Compass's project director, and you can see on the right the partners that are a part of the Colorado Equity Compass Collaborative. I will turn it over to my colleagues Alina and Jeff to introduce themselves.
Thanks, Rachele, and hi, everyone. Thanks for joining us today. As Rachele shared, I'm Alina Taniuchi, and I work with her at Change Matrix as a change consultant, and I'm a project manager for the Colorado Equity Compass.
And good morning, everybody. My name's Jeff Bontrager. I use he, him pronouns, and I am Director of Research and Evaluation at the Colorado Health Institute. And the Colorado Health Institute is a nonprofit health policy research and consulting group. And we're really honored to be supporting the quantitative data portion of the Colorado Equity Compass. So we'll be talking a little bit more about that later in the session. Thanks for being here.
Thank you, Jeff. And I want to acknowledge our other partners on the collaborative. We are funded by the Colorado Trust, which many of you probably know is a health equity foundation in Colorado. And our website and design partner is Consume and Create. And Change Matrix serves as the managing kind of partner for the initiative. So we want to share or hear a little bit about who's in the room today. So if you could please share your name, your pronouns, if you're comfortable sharing that, or if it's in your name already, that's great. The organization that you are affiliated with, the county in Colorado that you are joining from, and maybe something, a favorite thing about where you are located. And we always enjoy being in these spaces together because we get to see where everyone is based around the state of Colorado. We all happen to be based in Denver County, but we hope that we're getting folks from all across. So if you could put that into the chat, it helps us give a sense of where people are coming from. And it might also help drive kind of how we look at the data later on in today's session. So I'm just waiting for some chats to come in. I hope it's available. Okay, great. And maybe you're all thinking about the favorite thing about where you're located. So I'm seeing.
And, oh, sorry, Rachele. People may need to change the "to" in the chat to say everyone. It
Yes.
might just be going to panelists, but it looks like people are doing that.
No, I think people are getting in there. So great. Seeing the zoo for Colorado Springs, all the parks in Denver, walking paths. We've got somebody in Boulder County who loves all the trails. Stephanie from Moxley Public Health, where they use data to complete community health needs assessments. All right, that's great. Thank you. So lots of folks who are in the kind of Denver metro area who are loving farmers markets and trails, everything we have access to, the diversity of Aurora. Great. Welcome. Mia is on here from the Colorado Trust, and she is in El Paso and loving the Garden of the Gods. Welcome, Mia. Thank you so much to enjoy and appreciate in the great state that we live in. So thank you all for sharing. Oh, and somebody loves their library, huh? Okay, great. That's wonderful. Thank you for sharing. All right, we will move on to share a little bit about what you can expect during our time together. So the Colorado Equity Compass is really grounded in taking an equitable approach to thinking about data storytelling. So we're going to share that throughout the session, strategies for you to think about or questions to ask yourself as you're thinking about data and stories. We're hoping to give you some time to think about how you might combine data, visuals, and narrative to create a compelling data story about health equity in your own community. And we hope that we'll give you some action steps as well at the end that might help you think about what you can do in terms of policy or program changes to help further your social justice efforts in your communities. So you might have seen the welcome video at the beginning of the conference. The Colorado Equity Compass, with the support of the Colorado Trust, is pleased to be a sponsor for the conference. And our vision is that Colorado will have thriving communities that are empowered by their data and their stories. And the Colorado Equity Compass started because of our work in communities. At the foundation, what the foundation was hearing was that folks in communities wanted more localized data, that it's great to have county level data, but often, and you all know this, that our neighborhoods don't always necessarily reflect what county data is showing us. We also heard that people really needed a platform to be able to tell their stories. Oftentimes, quantitative data doesn't really necessarily tell the narrative of a community, or there's a nuance to it. And so it's important to join that data with stories so that communities can really be in charge of telling the narrative that is important for their community. We also wanted to make sure, as I said earlier, that a platform was committed to equity. And so we're excited to share that with you a little bit later and show some of the ways in which we do that. So I'll pass it over to Jeff, who will share a little bit more around the mission of the CEC.
Thanks, Rachele. So Rachele talked a little bit about the what and the why of the Colorado Equity Compass, and here's a little bit about the how. And what I want to speak specifically about is how the tool can be used for advocacy and change making. So how does this tool aim to address health inequities and systemic racism in Colorado? Well, it's by sharing crafted and local data, inspiring communities to share their lived experience and stories, positioning data and stories so everyone can access them for action, and then consolidating diverse equity related resources and offering some training and capacity building as well, those opportunities to really use and apply the information on the Equity Compass. The bottom line is that the Colorado Equity Compass is unique in creating a platform for both quantitative data while reinforcing the power of people's own stories. So where can this action take place? Now, I know I'm talking to largely a public health crowd, and I think we all know that there are many, many factors other than just access to health care that influence a person's health. So the Colorado Equity Compass is oriented around the social determinants of health. They are factors like the environment or air quality, housing, food security, economic conditions, et cetera, all the things that contribute to well-being of communities in our state. And Alina's going to show us actually a little bit about how the Colorado Equity Compass is oriented around these social determinants of health and about data storytelling. So take it away, Alina.
So actually, I'm going to jump in first, Jeff. Sorry, just a little switch there. So we are kind of based around the best practices of data storytelling. And so we wanted to share this visual with you, which will organize the way in which we go through the rest of our presentation. So we know that when you combine data with visuals and a narrative, that you have a much more powerful story, and we call them data stories. And so you can see in this graphic that when you put data together with visuals, you can allow a person to be more enlightened or to see better what the data might be sharing. When you put data together with a narrative, then you're able to explain that data rather than having the person needing to try to figure it out. And when you pair narrative with visuals, you're really engaging a person in that story around what you're trying to tell. And when you put those things all together, it's a powerful tool for change. So we'll walk through each of these components, the data, the visuals, and the story and the narrative in a bit. And what we want to offer you on the Colorado Equity Compass site is a little bit of a journey that you can go through that helps you think about how to use data to tell your story. And we developed this tool in collaboration with 4 pilot studies that worked with us at the Colorado Equity Compass at the very beginning of the project. And as we were supporting them in their health equity work, we realized that there were kind of some of these steps that communities went through in order to get their data story. So we look at defining an area of focus, finding the existing data that's already there, figuring out if there's some data gaps and how to then collect that data, and then going through a process of exploring the data to then help tell engaging stories. So that's a little bit of the journey that we walk through with communities. And in fact, we recently just finished a training series where we went through each of these steps with a cohort of folks to help provide some support and thinking around how they might go about that journey. So the first effort really is, what is that story you're trying to tell? And as Jeff mentioned earlier, we are really focused around the different social determinants of health. And so what are those factors that are influencing health in each community the most? Is there something that is kind of rising to the top, or is there something that community members are really most focused on? And so thinking about what is that story that is, what is emerging in the community that is important to share. And so we wanted to also make sure that as you're thinking about stories that you're trying to tell, that you're taking a real ethical approach to how that story is emerging. And some of you are probably already doing these strategies. We really like this visual from the Data Ethics Guidebook and Toolkit done by a colleague of ours, Michael Arnold, who talks about how we really need to be moving from this mindset of doing no harm toward moving towards how do we add value and do this work with care. So as you look at the items under do no harm, it's important to be transparent around why you're doing the data storytelling and how that is going to be used, to really be thinking about what's the community context in which you're working, and what are the expertise that might live in that community, and how to think about disaggregating data. Oftentimes, and I think many of us are doing this now more as best practice, but recognizing that we really need to look at the nuances of particular groups and communities and engage in a process where communities can help us as public health workers or as researchers or evaluators to understand what some of the differences might be. So that's when you're not doing any harm to the community. But how can we think about how we're adding more value into community? And so when communities are really driving what the priorities are in terms of the stories that need to be told, then that's putting community at the center. Think also about how you use methods that really add value, so that we often talk about partnering, not doing for community, but doing with community, and actually leaving community with the capacity to have to build the skills to tell their own great stories. And then finally, we also talk about thinking about how we engage community in making sense of the data, because if you're not from the community, then we're often putting on a bias or a lens that isn't necessarily going to be as supportive for understanding the data. So one of the visuals that we like to share around engaging communities shows a continuum of how you might think about engaging community in storytelling. And I encourage you to just look at this and think about where you might sit as you are either a community member or as you're engaging community in a process. So from the left, you can see informing, where we're keeping community informed of progress or findings or things that are emerging. And I love the visuals on this graphic because you can see it really quickly. You can see if you're thinking about you as the person or the research or evaluation team kind of giving information out to community. In consult, you might be thinking about how you listen to community, how you gather information or feedback from community. As you move into Evolve, it's more of what's that bidirectional communication that's happening where you're getting information, you're giving information back, et cetera. But then if you kind of think about shifting into more of the collaborate and empower section of engaging community, you can see where there are more bidirectional lines going on between and within the group, all the way to empower, where the community is driving the process of data storytelling. So just think about that a little bit as you're engaging with community. And the last slide of this section is really thinking about kind of, actually, that is the last slide of this section. So I'm now going to turn it over to Jeff, who's, as you remember, we had those 3 components. He's going to talk a little bit about the data part first for data storytelling.
Yeah, thanks, Rachele. And so building off of that theme of collaboration and empowerment, in engagement, I really like this quote from a colleague consultant named Billy Joe Rogers, and I'll just read it here. Data is an extension of a person or groups of people, and therefore should be created as you would treat people, respectfully. For instance, data are the words, thoughts, feelings, expressions, interactions, and contributions from individual people. It is not abstract, objective, nor distant or removed from people. To me, this quote really reinforces the notion that we need to be thoughtful, we need to be intentional about how we use data, because as he indicates in this, data is an extension of a person or an extension of a group of people. Next slide. So how do we make a data collection action plan? Well, part of this being thoughtful and intentional about the use of data is to develop a data collection plan. And it's best to make a plan for how you're going to go about collecting additional data. This helps to ensure you're not overburdening yourself, and especially you're not overburdening the people that you're collecting data from or data about. And we can think of this as an equity issue in and of itself. I think we're all familiar with cases where a researcher kind of swoops into a community, collects a bunch of data, and then leaves and does not and creates an extra burden for the community. But not only that, there's no sort of reciprocation of the benefits of that data collection. A data collection plan also helps make intentional decisions about what we will evaluate, what tools we'll use, who will collect the data, and how we will use the data we collect. If possible, also think ahead to what you're doing with the data that's collected. How are you going to analyze it? How are you going to share it? I want to emphasize this point that's at the bottom of this slide. So at the Colorado Health Institute, we often say that half the work is just coming up with the right research questions or the right guiding questions. So determine the questions that are clear and specific, measurable, and meaningful up front. And that will really help in terms of making an intentional and thoughtful and respectful data collection plan. And as you are implementing that plan at all points, it really is incumbent on us as researchers or data collectors or data analysts that we use an equity lens when collecting data. So what do we mean by applying an equity lens? Well, it's an acknowledgement first and foremost of inequalities and inequities. There's a quote that I really like that is that people are the same, but their barriers and starting points vary. So people are not inherently disadvantaged, and they are not the cause of their own inequality. There's lots of barriers that exist in terms of institutional barriers, cultural, legal, economic, historical, prejudicial. And then also people have different advantages too. We all kind of start at different ground level starting points. In thinking about equity issues and people working together, equity really is around using the tools they have to break down barriers and even that ground, even that playing field on which people stand so everyone can thrive. At its core, applying an equity lens is applying a set of reflective questions leading to more equitable actions. So here are some common questions when looking at data that's been collected through an equity lens. Who's affected? Who is impacted? Have those affected helped to shape the data collection? Who was included or excluded? Who has benefited? Who was harmed? What assumptions may have taken place? And then what data were missing? With those considerations in mind, I'm going to turn it back to my colleagues at Change Matrix to demonstrate the Colorado Equity Compass.
Thanks, Jeff. Can you all hear me okay? We have some other folks in now. Okay. All right. So this is the Colorado Equity Compass website. Here you go to the homepage. And what we'll be looking at for this portion of the session is introducing the equity data navigator that we have on the site. So this has some social determinant of health related data specific to Colorado at the time, and trying to find some really hyper local data is important. We can recognize that there are lots of folks in our state and lots of different data that has been collected. And so trying to bring those all into one place felt important in terms of making data accessible and hopefully usable by folks across the state. So we're going to go ahead, and I think I heard folks were joining from Boulder County. I might check that out. You can start typing in any of the counties in our state, and you'll see you start getting a list. So if I were to Denver, where I live, you'll see that it starts to populate, and you can click on one of those to dive deeper into the data. I'll pause those for a second. Might have a little bit of an issue with my connectivity. Rachele, are you able to bring up the compass on your screen?
I will share my screen, but you have to just, yep, there you go. Great. I had already pulled this up, El Paso. Alina, do you want me to walk through it or do you want to?
Sure, I can share a little bit more and then please feel free to hop in. So for folks who haven't seen it before, this is the Colorado Equity Compass's Data Navigator. As Rachele said, we can use it, or as I was sharing earlier, we can use it for any county. So she had pulled up El Paso. And there are a couple of really nice features I wanted to highlight here. We did do some upgrades recently. So you can see as you hover over the map, you can click into any area and see census tract specific data for that area in which you have clicked. So you kind of see all of the data on the screen updates as you click around. You can also zoom in on this map. It's integrated, I believe, with Google Maps. So you can start to see landmarks as well as you're navigating through the site. So if you want to look at, oh, what's going on kind of near this lake or near the school building that I'm familiar with, you can kind of click through and find your data as well. And then to just select an area, you just click on that again. So you can see that kind of yellow highlight. And then if you click on it again, it goes back to the county as a whole. On the right side here, you can see that we have a few different demographic related panels. So right now it's showing the population by race and ethnicity within this specific census tract here. And as you scroll through, and you can kind of do a slide or you can scroll through using the arrows at the bottom, it starts to give you a little bit of a better picture of what's going on within population at each of those, at the geographic level that we're looking at. So we thought that it was a really important aspect and one thing that was maybe not readily available within other platforms to start to tell a story of what's happening within a community in a given area, especially with Colorado specific locale. So they start to tell a little bit of the story about what we're maybe seeing here, and maybe it's the correct story, or maybe it's one that's disparate from what we know to be true as well, in terms of the experiences that folks are having within an area. So within each of these, we're looking at the population percentages and then the median family income, as well as education data where it's available, specific to bachelor's degree or higher. The reason that these were the factors chosen to display within the demographics panel that we have is because they were the data that were most closely correlated. Jeff, correct me if I'm wrong, to better health outcomes within Colorado. And then we also have languages spoken at home, and I think, educational attainment for the general area, not broken down by race and ethnicity. Across the bottom here, you'll see some of the outcomes information that we have as well. So the compass is oriented around what some factors that are kind of indicators of good health. So we do have the average life expectancy, and then self-reported good health, and as well as self-reported good mental health within those areas. And then you can see the general racial diversity of residents as well. In the little kind of yellow pills, as we call them, you can also see the distance from the state average in terms of percentage. So for the area that is highlighted right now, you can see that a lot of it is lower than the state average, I believe. except for the racial diversity of residents, which is about 5% higher. As you scroll down the page, you can see more information within each of those kind of categories. So you can see we have some kind of buckets of social determinants of health. And if you click into them, you can start to see some specific data points for that given area. So again, this is looking at a census tract within El Paso County, which is largely performing below the state average at the time from this data, which is using data, because I think this is a question we often get. It's using data from the 2015 to 2019 ACS for the most part. And then we have a couple of other data sources that have also been included within this index. So this is an area that you can see kind of where maybe the geographic area might be struggling. We do have these 5 key factors, which we won't go into too much right now, but that's kind of what, as we were talking earlier about some starting points of identifying, you know, where our needs or where our strengths and where are kind of the levers to change. Those 5 key factors work in the top 10 counties, top 10 populated counties in Colorado. And then just quickly wanted to show as well the ability to kind of compare between geographic areas. So right now, the way that Rachele has it selected, we're looking at the county census tract and comparing it to the county itself. So you'll see those outcomes data. We also have this radiograph that kind of shows those areas in which, you know, the yellow is the state average, and then we have folks performing well above within the county as a whole in food, but you can see that in that specific census tract shown in kind of that red burgundy color, food security is likely very low based on those factors that were kind of shown in the tree graph in the previous. And then you can look down below here and you can kind of expand upon what are each of those areas. So yeah, you might be interested in economic and seeing where the county lies as a whole versus what's going on in that specific area. So you can see the median family income is almost 40,000 different, which is pretty different in that area. So you can click through and just learn a little bit more about the areas that you're interested in. You can do census tract to census tract comparisons. You can do census tract to county, county to county. So hoping to bring data to a really relatable place for everyone. I'm sorry if it's loud. I am going to go back on mute, but yeah, wanted to share a little bit about those equity compass, and we'll engage you to hopefully click around in that and use it a bit more throughout the presentation today.
Thanks, Alina. We're going to give you all a little bit of time later on too to explore the site as well to help you think about a data story. So one of the things that we wanted to make sure that we were doing when we were sharing this data and putting it on this platform is ensuring that we're thinking about how comparisons are made and how they are fair, appropriate, and not blaming of any individual or group of people. And so you'll notice that's why we actually only presented the racial ethnic diversity of a community in one graph, just so you could see the breakdown and percentages. But then, for example, we didn't do education by race, ethnicity, and data, but we wanted to show it within their own group. And we feel that's really important because there is a tendency when looking at data by race and ethnicity or breaking it down that way to use the white group as the comparison. And so we wanted people to be thinking about it within group and what it means for particular communities. We also encourage folks to think about how you're looking at that data separately or asking multiple people who bring different perspectives and lived experience to think about what the data might mean and how they're interpreting findings. And this is mostly so that we can check for our own biases that might be introduced when we're looking at data. We also encourage folks to think about not forcing data into categories if it doesn't work or if it's not right. And so sometimes we tend to think, oh, we always have to do it this way. And that's not necessarily the case. So think about why you're putting groups, creating groups of data, what purpose is that going to serve? And then also thinking about, and this we'll get into this later on, but kind of then thinking about the quotes, thinking about the qualitative data that can help just give life to quantitative data to tell a story. I see a question in the chat. Oh, and I forgot to mention this at the beginning. We love questions and we prefer to be more interactive as we're going along. So if you have questions that are popping up at a particular point in something that we're presenting, please do put that into the chat. Jeff, this is probably a question for you. In addition to social determinants of health, do you use UN sustainability goals?
We have not, to my knowledge, used the UN sustainability goals, but that is an interesting idea. And as we're thinking ahead to making enhancements to the Colorado Equity Compass and updating the data, we will certainly take those into consideration. I would be interested, Judith, about whether there's some particular ones that you think would complement the Colorado Equity Compass in particular. And then I wanted to just also respond to a question that was a little bit further up in the chat about the sources of the data and the years. And currently there is some information, I'll put this into the chat, but there is some information about the sources on the data transparency statement of a portion of the homepage of the Colorado Equity Compass. But an enhancement that we're hoping to make to the downloadable data is to include those sources and those years for all of the indicators in that workbook. So if you have particular questions about specific indicators, feel free to reach out to me or to any one of us, and we can get you that information.
Thank you, Jeff. Yeah, it's really important for us to be transparent in terms of where this data is coming from and who might be missing from this data because of the particular data sources that we are using. So we do have a statement about that on our website, and and Judith, thanks for just sharing information about the UN sustainability goals. Part of what our interest is making sure that we're sharing data that's available at a very local level. And so sometimes that does also limit the data that we can use for this site, although Jeff and his team have a lot of skills around creating small area estimates. And so that is one way that we're able to get around that a little bit. So anyway, we'll pass it on. Thanks, Jeff, for sharing that information, and we'll pass it on to Alina to talk a little bit more around the visual aspect of data storytelling.
Yeah, thank you. So this quote came from Heather Krause at We All Count, who has a wealth of data visualization and other data use on her website. But we kind of like this quote to start out: the best data visualization is the one that tells a story which needs to be told. There's new universal rules for how you should explain numbers with pictures. Make your data viz for the people who are your data. So going back to a lot of those ethical and equity considerations that we talked about earlier, and remembering that these are people and these are people's stories that we are using and representing hopefully well in our data visualization. And that some of the things that we're sharing here are not necessarily best practices, because it's really hard to say this is a best practice for your particular data or for your particular community. We really want to center again that community aspect as we're visualizing data. So these are a few of those considerations as I was mentioning. You want to have a clear understanding of the data you're visualizing. So I think it was a great time to talk about what are our data sources and what are the limitations of those data that we are using. It's important to understand who's included, who's been excluded, how the data was collected, whether that's fitting for the community or not, whether folks can see themselves in whatever the data collection is. And it's something as you take into account with visualizations too, whether you're actually representing the data that you have and the community that you're communicating about accurately or to the best of your ability, and also explaining some of those limitations. One of the things I recommend a lot is to look at your data with empathy and think about, if I were part of these groups that I am communicating about, how would I feel about the data that's being shared? It's a good way to think about, am I telling a story that is fair to any and all groups that are being represented in it. When it comes to labels and language, there are some best practices maybe out there around using people first language, such as people with disabilities or a person of color, communities of color, rather than some of the other language that we've had used in the past. But that's something to be mindful of, is that language always evolves. And so you may have used a term previously, and it's always a good idea to check in with community and say, does this label feel accurate for you? Does this feel how you would like to be identified? And then you can also think about the missing groups. I think that's something that we have often put in kind of like an other category, and it doesn't always feel good to be an other. I know for a fact that that's something that I've been in a position of before, and sometimes it's nice to reframe around another that's not listed here, or all of their self-descriptions, or even saying an identity that wasn't listed within the survey or the data collection that was provided. It puts a little bit more of the onus back on the data collector versus an individual. When we're talking about shapes and colors and icons, try and not to reinforce some of those stereotypes that have been put out there, such as gender or racial. Don't use blue and pink necessarily to represent different genders. And it's also important to think about your accessibility when it comes to colors and icons. So looking at high contrast, there's a great website out there called colorbrewer2.org, I believe. And they have some good equity kind of considerations in terms of how you're looking at data, both if it's like light to dark, making sure that the contrast is high enough, or if you're doing separate groups, it's color friendly for folks who have color blindness, or printer friendly as well. So those are just some things to keep in mind as you're doing colors and shapes. And then always go back to involving community. Make sure that what you are visualizing makes sense for them. There are so many different ways in which our cultural norms have shaped how we communicate. And so it's really important that their experiences and what is familiar to them is represented through visualization. As we were saying, it's not necessarily something that's easily like, oh, in this case, you use this graph, or this case, you use this. There are multiple ways to approach it. So I'll quickly share if my screen will, there we go. Here's actually an example of a data visualization that I believe this is a inking kaput. So it's a tied visualization in terms of where each of these knots exist and on which colored lines and how they're connected to that kind of the main line up top, all tells a story, all visualizes a data within their community. And it's a beautiful way that they were able to share information. And it's really important to honor the different ways in which data visualization has been going on for centuries in human history, and really making sure that we're honoring all forms of data visualization. And it's because it's important to have folks' data count and their visualizations count beyond like kind of the historically dominant group, the white cis hetero men who have often kind of claimed data visualization as their own. It's really important that we go back to what communities have used and what they resonate with in order to make data visualizations that work for them. So we have a few other points under here that I'll try and make quickly because I know we don't have a ton of time. But do you think about, as I talked before, considering the data that you don't have as well. So I used an example recently about thinking, as we're looking at education data, and maybe we would be looking at that by educational attainment within racial and ethnic groups. And if you have data only spanning back to, the 1960s, what happened before that? What might have happened prior to that time in history, prior to the civil rights movement that was happening at that time? What would happen if you expanded out your kind of lens in terms of what you're visualizing? You might see a very different trend based on that, or you might be missing data based on that. So visualizations are a great way to actually kind of ask more questions of your data that you might not have had before. You might start visualizing something and it might start bringing something up for you that you didn't realize was a question. And it may lead to more data collection or just more explanation around why the data is how it is. And then thinking about each of your symbols or your colors as characters. So we'll get into the stories a little bit more. But something that you want to try and be really mindful of as you're telling a data story, particularly, is if you're using a color to represent folks who have a specific experience or within kind of a topic area or population group, keeping that color consistent throughout your report or throughout your story is really important to have it be recognizable to the readers or to the audience that you're telling the story to. So I'll just show you a quick visualization. I know I said you can't have oh, this is what I need, so this is the visualization that I'm going to use, but it's a great starting point. I think that's offered up by Stephanie Evergreen and folks. And so these are both qualitative and quantitative kind of suggestions as a place that you might start based on kind of some questions that she asked. So what do you need to actually be representing and what are some kind of effective ways to do so? But I really like this different kind of visualization that's offered up by the Urban Institute. So it goes back to what Jeff had shared about, folks, this is actually folks' data. This is their stories, this is their experiences, and starting to bring in that humanization of the data if possible. So it takes it from this kind of almost stale graph that we've got here at the top, where it's millions of people are living in poverty, to actually showing the people that feels a little bit more wow, that is a lot of people, experiencing poverty, and it brings it back from being this just a bar that you don't really resonate with to the actual human lives that it's impacting. Because I think that's a really beautiful way, if possible, to start thinking about how do you bring that human back into the data that it came from. So I'll pass it over to Rachele to talk about the storytelling portion.
Thanks, Alina. And there are a lot of kudos in the chat for thinking about how we visualize data in a more humanistic way. So thank you for sharing your thoughts and experiences around that. So I'm going to talk about that third component now for data storytelling, which is the narrative. And so we know that for thousands of years, storytelling has been an integral part of our humanity. And even now, even though we're on our phones and our computers a lot, stories continue to appeal to us just as they did during our ancestor time. And so we get them through entertainment, through the experiences that we share. It helps us dream. And so pulling a narrative into data is really important. There was a study that was done by Chip Heath, who's the author of the Made to Stick. And what was found was that 63% of people could remember stories from a presentation, but only 5% could really remember a single statistic. And so when you think about combining data and stories together, it makes it so much more powerful so that people can remember all of this together. And so we like this quote: people will forget what you said, people will forget what you did, but people will never forget how you made them feel, by Maya Angelou. And I think this is the true power of a story, is that when we hear stories, we know that our brain reacts in a very different way to various elements of a story, and that's what makes them stick. So some things to be thinking about as you're considering storytelling, some ethical and equity considerations. So first is really investing in the relationships to build trust and mutual respect and collaboration. We like to use this term that investing in the partnerships, you've got to move at the speed of trust. And that's really vital in order to not be extractive or transactional in the way that we approach someone who's going to tell their story. We're not wanting to parachute in to collect a story and then abruptly leave. And so those relationships are really important. And it helps people to support their ability to tell their story in a way that best reflects their own truth. So as you're thinking about engaging with communities that are going to be telling their stories, Not only do you want to build that trust up front, but then also think about how you stay in touch with the people telling their stories after that process. How do you develop those relationships further and support it into getting into a change movement or sharing their stories broader as well. When you're at that beginning process, you want to make sure that you prioritize informed consent and transparency throughout the whole process. So the narrator of the story should be really fully informed on what the scope is, what the purpose is, how they're going to participate, how their narrative is going to be used or shared, and who the audience is going to be. So you want to make sure that they know that they have the option to opt out or to request their narrative be kept back at any time during or after a project. If anonymity is important, that must be offered, pseudonyms to protect privacy, just so many things to be considering around how the narrators can control the story. So make sure that you're engaging with them in terms of giving drafts or having opportunities to edit or to give approval, and really knowing that the narrator should always own their own story. Also important to think about how to have a trauma-informed approach, knowing that sometimes stories will bring up different experiences for folks that could be re-sparking of a trauma. And so making sure that you're considering that as you're asking people to tell their own stories. And finally, just making, again, sure that the story is owned by the narrator and they can have access to it at any time in the community. All right, so as you're thinking about a good story, and we just finished up again, as I mentioned earlier, a whole training around this, thinking about the basic components of a good story. And we know, I'm just going to ask you to think a little bit about what's your favorite story? Like, is there a story that you always go to? And maybe you can share that in the chat. What's a story that you either loved as a child or that you continue to go back to? It's a book that you're always going back to and reading multiple times, or a movie that you've watched 10 times. What's a story that you have really enjoyed in your lifetime? I will just share that I just love The Sound of Music. I was exposed to it when I was a little kid, and there's just something about that story that always just was like, the tension that kind of built up around this family and what the war did to them and the way they were able to overcome. So I don't know, put your favorite story in there. We'd love to hear what they are. Mia's put in, give a pig a pancake. That's a great story. In our training, we tried to use the 3 little pigs as the story to highlight, what's the character? What's the emotion that comes out? What does it draw for you? So Jeff and Alina, I want to see your favorite stories in the chat too. Well, Alina, you don't have to since you're sharing your screen. But when you think about your favorite story, also think about the structure that it has. Every good story has a structure. And so sometimes we talk about good stories as having a beginning and a middle and an end, but this time we want to expand it a little bit to think about this 5-beat storytelling. And you'll see this kind of play out in storylines for a lot of good reasons, because it brings the audience along. So, oh, thanks, Alina. Where the wild things are. That's a great story. So really kind of the introduction is all about setting up the scene, establishing who is in the story, what's going on, what's the context. So you can think about that in terms of your community, like what's your community? What's happening in Southeast Colorado Springs? We worked with them around the thinking that they were living in a food desert in this one neighborhood. And so that was their setup. We don't have access to good, healthy grocery stores. So then think about what's the incident, what's kind of starting. So there's several things that might be happening to that community, whether it's a railroad that went in or something like that a community might respond to. So there's that kind of sense of urgency that's happening. You can use imagery or sensory details to kind of bring this part to life. So maybe a community is getting a new development building, or a big employer is leaving in a rural area and lots of jobs are going to be lost. And how's that going to impact your health? So you think about the rising action that is happening then, that's giving weight to the context and context to what happened to an employer leaving. And so then the community is going to have to make some choices that are going to have some consequences and some impacts. And that's that climax now. There's some kind of a turning point, some kind of an emotional tension that happens. I don't know what that is in the Fisher King, but Jeff, you'll have to tell me about that later. So the story doesn't have to be about the community, achieving health equity, but it might be like some middle point, some turning point that is happening. And so for Southeast Colorado Springs, it was this recognition that they actually didn't live in a food desert. They lived in a food swamp where they were getting access to lots of really kind of cheaper, not healthy food. And so then what's the transformation? What's the community going to do as a result of having gone through that kind of process, that knowledge, using that data? Or what are they going to do differently? So that's a bit about the structure of a story, and you can think in your own mind around whatever your favorite story is. You can note kind of those things happening. You can notice subplots where this is happening multiple times, but it engages a person in listening to that story. So we want to give you a little time to practice this. Alina, how have we got it set up now? We were going to have you go into small groups, but we're not. Sorry, Alina, go ahead.
Oh no, I wasn't sure whether we were doing small groups or not. So I think we'll just take some time then to maybe look at the social determinants of health, since that's where a lot of our data lies. And identify maybe one of the areas of interest. Maybe you already have one in mind from your work or from your interests as well. Maybe try and pull a data point from the equity data navigator that we showed earlier, just to pull in a data point. And then we were thinking maybe like a 3-sentence story or something like that you all could work on developing. It could be made up, or it could be based on something that you've been working on or you're familiar with. And maybe just create a quick data story. I think we've got a couple minutes to do this, if we want to have some separate time for Q&A. Does that sound okay, Rachele?
Yeah, maybe about 5 minutes for folks to just play around on the screen, on your own computer screen, around looking at data or data that you might already have. And then thinking about that structured story, if you want to just do a 3-point beginning, middle, end, or the 5-beat structure that we just gave, just want you to write that down on a piece of paper, super short, but it just gets you starting to think in that way. I feel like I should play some music, and I'm never ready to do that. Let me try. All right, we'll draw you back into the room. Thanks for sharing some music, Alina. And I always forget to get it set up and then I can't figure it out. So anyway, we'd love to hear from you around what that process was like for you. Maybe a piece of data that you were looking at and maybe a story that might be emerging for you, or what felt exciting or a little challenging in this process. So if you would like to unmute and or put something in the chat, we'd love to hear from you. I know I was, just to share, I was at the University of Colorado, Denver, presenting the CEC for a public health class. And it was really fun to be in the classroom with students. And we had a group that was looking at Boulder, and they were looking at the transportation in Boulder and noting that it was not a very friendly space for transportation in the one particular track that they were looking at. And they were kind of creating a narrative around how students on campus, I think that's what they were looking at, were not having as much access to kind of public transportation or to cars. And so they were kind of building a story around what they were noticing in that area of Boulder. Anyone else want to share something that you might have noticed or found on the website? We're hoping that you spent that time getting in there.
Hi, are we allowed to unmute ourselves?
Yes, you're most welcome to unmute.
Wonderful. Well, one of the narratives I kind of pieced together, it was interesting. I looked up Arapahoe County, and all of the other measures were, above state average except for health services. So when I clicked on that, it was interesting to see that while 92% of Arapahoe County residents are insured or have health insurance, there was 0 health facilities per 10,000 residents. And so that to me says a narrative about kind of the allocating of resources and facilities in an area, and yeah, I mean, it was just kind of profound to see those kind of opposing numbers. So
Yeah, that's great. Thank you so much for sharing that. And I think that's a great example of like, wow, I want to learn more, right? I like want to go into the community and find out what's happening here. And how can we get more of that story behind those kind of two different data points. Thank you for sharing. Great. Well, I know that we don't have a ton of time left, so we're going to move on because we wanted to talk a little bit about how you might take some of this data and bring some action, get some action here. So Alina, did you want to jump in here or do you want me to? I know the sound issue. Okay, I'll go. All right. So as you're thinking about your stories, be thinking about a couple of ways of how to share that story. Again, we shared that structure of a 5-beat story. So we know, and we have a bunch of data stories on our website or on our platform that are short, right? They're things that are easily consumable. And I think in the age that we're in right now, thinking about how you can create stories that are short, but impactful and have a really clear message. And so we've put out in the past small awards to support communities to be able to tell their story, whether it's like helping to support them with the videography or with blogs or recordings or the visuals piece. So think about how you might want to share that story in a way that's going to meet or get to your audience in the best way possible. And so we have a space on our website where you can upload stories. And so we're always looking for stories from communities because then we compare them with that data, the quantitative data that you saw in the equity data navigator that Alina walked us through. And so finally, the other action that we wanted to leave you with was really around thinking about how do you, hang on, I know we're getting to the next slide. How do you move into action? And so on our website, and I don't know, Alina, if you can get to that or if you want me to go into that piece, we do have some ways to think about how you can take action from the data that the data that you're looking at. And so we do have a module on our website that is called, it's the call to action module. And there are different ways you can do that on our website. You can do that through finding partners. So we have developed a database of community-based organizations all around the state. If you are at a community-based organization and you don't see yourself on here, please let us know. We'd love to add you on. We're in the midst of they're all geotagged. They're all connected to social determinants of health that they might work on. And so you might find some data and see if you want to reach out to a particular group that's doing some work in that area. We also have stories that are connected with each of the, we'd love to have stories from every geographic region in Colorado, but we don't yet, but they are tagged to the section that you'd be looking in. So if you're in El Paso County, here are some stories that might pop up related to that geographic area. And so I think this is Denver, but you can always share a data story with us by clicking on that little link that you can see up on Alina's screen. Oh, this is Arapaho. All right, so thank you. Here's the form that we are looking at if you want to submit a story to us. And again, we just like to make sure that you have permission to share those with us. We want to make sure that they're shared back with the community and to help to bring more life to the data that's on the CEC site. All right, so I think we do have some time for questions, so feel free to pop any questions that you might have into the chat. I also just want to share that on our website, we are going to be putting up a live survey. So if you have find that pop up when you're visiting the website, we would really appreciate you sharing some feedback with us around how you might have used the Colorado Equity Compass, what you would like to see it do in the future. This will help us as we're continuing to think about ways to sustain this platform for the state of Colorado and make sure that every person has access to data in a way that's easily visible and visual. So please do stay in touch with us. We've got all of our contact information up on the screen right now. And we do have various social media platforms that we're on, so please do feel free to connect with us through that way as well. So Jeff, there is a question in here around how often the quantitative data data is updated. If you could respond to that.
Sure. So we are going to try to update the data every year or every 2 years. Currently, the information that we have up there from when we did the last refresh of the data is mostly from 2019. Now, there's been a lot of data that's been released since then, and also some of you who are really familiar with different geographies in Colorado may note that some of the census tract boundaries have changed after the decennial 2020 census. So one of our goals for this year is to update the data with the most currently available data, and also update the maps on the site with the new census tract boundaries. So stay tuned for that.
Thank you, Jeff. And I think, oh, go ahead.
I was just going to say another kind of portion of that call to action, which isn't too updated at the moment, but we're also hoping to add some local data sets to be geotagged and accessible within each of the kind of counties where the data exists. So that hopefully it'll bring some more of that data that we can't really incorporate directly into the index because it's not available across the state in all communities, but hopefully help to put at your fingertips some more of your local data as well.
Thank you. Are there any other questions that we can answer? It looks like there's an interest in the post-COVID data. We agree. We know that COVID has changed our lives dramatically and expect to see that in the data. So please do keep in touch with us so that we can let you know when data is updated on the site. And, you know, we're always looking to figure out how we can advocate for more data that's available at census level track so that people can use that data in a very localized manner. So Jenny's got a question about sharing the story submission link. So I will pop that in for you right now too. And actually, I can't find it. Did you get it, Alina? Yep, there. Thank you.
Thank you for sharing that.
Yeah.
And thank you all so much for your wonderful presentation. This was so refreshing for me personally, as somebody who has worked with community to help tell their story in the way they wanted it to be told. And so this is just so meaningful. And thank you all to the audience for attending and engaging in this session. A few short announcements before you head out. Slides and any additional handouts the speakers have will be provided in SCED. You will receive a conference evaluation form email soon after the conference is over. Please fill that out if you have capacity, even if you only attended a portion of the conference. It is very important for us and our planning committee, and there will be a raffle for anyone who completes this survey within 2 weeks for $50. So a $50 gift card incentives. Up next on the conference, we have our last walk and learn session from 11:30 to noon. This will be presented in a podcast format. So if you have the opportunity to listen in while you want to get up and walk and stretch around, please feel free to do so. It's a great way to head out of the work week and into your weekends. And with that, thank you all again for your attendance. Again, thank you to your presenters, and thank you to our sponsors for this session, Trailhead Institute. Enjoy your Friday and enjoy your weekend.
Thank you.
Thank you.